is Tessalon Perles and my sister's name is Tessalon Zonatus. We are commonly known as benzonatate. And that is our chemical name. We are under the drug classification of antitussives. Therapeutic in allergy, cold and cough remedies, antitussives, local anesthetic. Pharmacologic antitussives, cough suppressants.
My pregnancy category is in category C, which means research in animals has shown adverse effects of the fetus when the mother takes the drug, and there haven't been enough studies in humans to be certain how the drug might affect the fetus. My mechanism of action is a local anesthetic that acts peripherally by anesthetizing and reducing the activity of vagal stretch receptors, or nerve fibers, which is located in the respiratory passages, lungs, and pleura. Once the stretch receptors are stimulated, they send impulses to the cough center, which is located in the medulla via an afferent pathway consisting the sensory nerve fibers or the vagus nerve. The efferent signal is generated that sends impulses to the expiratory muscles to produce a cough. By anesthetizing these receptors results the inhibition of cough reflex activity and cough production. I also inhibit the transmission of impulses of the cough reflex in the vagal nuclei of the medulla. My pharmacokinetics. I am usually administered orally. My onset of action is 15 to 20 minutes, and my antitussive effects last for approximately 3 to 8 hours. Unlike the other ester-type anesthetics, which is hydrolyzed to para-aminobenzoic acid, my plasma is esterases. However, my absorption, distribution, metabolism, and excretion are not well characterized. My indication is for symptomatic relief of cough. My dosage and administration is for adults and children over 10 years of age. My usual dose is 100 milligrams or 200 milligrams 3 times a day, as needed for cough. If necessary to control cough, the patient may be given up to 600 milligrams daily in 3 divided doses. I should be swallowed whole and not to be broken, chewed, dissolved, cut, or crushed. My side and adverse effects categorized per body system. In cardiovascular is chest numbness. In central nervous system are chills, confusion, dizziness, hallucination, headache, and sedation. In dermatologic are pruritus and skin rash. In gastrointestinal are constipation, gastrointestinal distress, and nausea. In hypersensitivity is hypersensitivity reaction, like bronchospasm, laryngospasm, and cardiovascular collapse. In ophthalmic is burning sensation of eyes. And lastly, the respiratory is nasal congestion.
Please take note that we are contraindicated in patients with ester local anesthetic hypersensitivity or a previous history of reaction to benzonatate. The benzonatate formulation also contains methyl and propylparaben. This may be a problem for patients with paraben hypersensitivity. In some cases, local anesthesia resulting from the sucking or chewing of the capsule has been responsible for bronchospasm or laryngospasm. Patients should always swallow benzonatate capsules whole. Do not chew or dissolve in the mouth. We are contraindicated in children, infants, neonates for potential overdose or poisoning. Children 10 years of age or older may receive benzonatate with careful administration instructions to avoid chewing or dissolving the dose in the mouth. Safe and effective use of benzonatate has not been established in neonates, infants, or children under the age of 10 years. Accidental ingestion of benzonatate liquid capsules possess a significant potential for overdose or poisoning to pediatric patients younger than 10 years of age, due in part to the candy-like appearance. Signs and symptoms of overdose have been reported within 15 to 20 minutes, and death has been reported within 1 hour of ingestion. Please take note that benzonatate is occasionally associated with CNS sedation, mental confusion, visual hallucination, or other bizarre behaviors. Patients should be advised to use caution with driving or operating machinery or performing other activities requiring mental alertness. We are contraindicated during labor, obstetric delivery, and pregnancy. Benzonatate is classified as FDA Pregnancy Risk Category C. Animal studies to evaluate carcinogenic and mutagenic potential and effect on gestation and fertility have not been performed. Due to a lack of available data on the safety of benzonatate during pregnancy, the drug should be administered to a pregnant woman only if clearly needed. Benzonatate is chemically related to anesthetic agents. Local anesthetics rapidly cross the placenta and can cause varying degrees of maternal, fetal, and neonatal toxicity when used for paracervical or pudendal block anesthesia during labor and delivery. We're also contraindicated in breastfeeding. According to our manufacturer, it is not known if benzonatate is excreted in human milk, and caution is recommended if the drug is used during breastfeeding. We are also contraindicated in patients with para-aminobenzoic acid hypersensitivity. Benzonatate is chemically related to anesthetic agents of the para-aminobenzoic acid class such as procaine and tetracaine. Benzonatate has been associated with adverse CNS effects possibly related to a prior sensitivity to related agents or to an interaction with concomitant medication. Please take note, geriatric patients taking benzonatate should be able to swallow the capsules as directed, as inadvertent release of capsule contents in the mouth can produce a temporary local anesthesia of the oral mucosa, and choking or other severe side effects could occur. Dear nurses, before administering us, you need first to assess for possible contraindications like allergy to the drug, cough for more than 1 week, pregnancy, and lactation. Then, you need to perform a physical examination to establish baseline data. Then, monitor the temperature to evaluate for possible underlying infection. Then, assess respirations and adventitious sounds. Then, evaluate orientation and effect. During administering us, you are responsible to prevent overdosage, assess underlying problems, and provide other relief measures from cough, like humidifying the room, providing fluids, use of lozenges, and cooling the room temperature. You are also responsible to educate the patient. It is to enhance the patient knowledge about the drug therapy and promote compliance. We are also responsible to provide emotional support. This will help the patient to cope up with the disease and the drug regimen. After administering us, your responsible is to monitor the adverse effects like respiratory depression, dizziness, and sedation. Also monitor patient response to the drug, like control of non-productive cough. We are also responsible to evaluate the effectiveness of the teaching plan and monitor the effectiveness of other measures to relieve the cough.